So in this next section, I'm going to just very briefly talk about the overview of the CwPAMS program and the fellowship itself, and share some of what the fellows have had to go through. They have worked incredibly hard over the last year. For those of you wondering why I've got an interesting outfit on, we challenged all the speakers and all the fellows to come dressed in something that reflects the countries that they've been to or have a love for, and I thought I'd join in as well. As my other co-hosts Emma and Sarah and Vicky, as you can see on through their videos as well. So this is the core team within the CPA team that have worked on the CwPAMS program. It's been an incredible journey, but very grateful for my colleagues who we've worked with together over the last 2 years. We've also got core TEF colleagues as well. As you'll see, it's very much a joint program when it comes to CwPAMS program between CPA and TEF. So CwPAMS, for those who are not aware, we're just going to give you a brief background. It's funded by UK Aid, particularly the Department of Health and Social Care's Fleming Fund, and it's part of the government's commitment to overseas development funding to support collection of data on antimicrobial resistance. And the core focus of the Fleming Fund is around surveillance of antimicrobial resistance. So we're talking about the bugs and generating relevant data that is shared nationally and globally. But as you'll see through CwPAMS and through other individual projects they've got in countries as well, there's been a key focus around stewardship or surveillance of antimicrobial use as well, and that's a core part. But and I think in its inception, it was about building lab capacity as well. And we're grateful for our Fleming Fund colleagues who are on the line and DHSC colleagues as well. These are the 9 core objectives of the Fleming Fund, and I won't go through all of them, but you can see there it's around supporting development of national action plans for antimicrobial resistance, developing and supporting implementation of protocols and guidance for antimicrobial resistance surveillance and use, collection of data, both resistance and sales of resistance data and sale and use of antimicrobial medicines, and then advocating for the application of that data. So out of the 9 objectives, the CwPAMS project, which is in Ghana, Uganda, Tanzania, and Zambia, focuses on 3 of those core objectives. And as I mentioned earlier, it's very much a partnership between TEF, which is Tropical Health Education Trust, and Commonwealth Pharmacists Association. In its inception, and for us to develop what became the program and what went out as a call for partnerships, we carried out a desk scoping approach where we went through the national literature of the countries, the 4 countries, and also had interviews with National Pharmacy Association colleagues. We had input from an expert advisory group, members. All of them had international experience, and a few of them, particularly WHO experience, or have worked with WHO in the past, or consultants within WHO in addition to that. So really trying to bring the understanding from the global, what is expected globally, as well as what is expected within country. And we had key input from the then Chief Medical Officer, Dame Sally Davies, and also Keith Ridge as the Chief Pharmaceutical Officer. Following that, we created a summary and had 4 country-specific resources, which included the status within that country, the literature review that we had carried out, and also resources that were already available, so that when partnerships were writing their call, they had some initial resources to work with. And obviously, from a national point of view, and then obviously working with their colleagues that they were partnering with in country, focusing on what they would then do within those institutions. And what we highlighted from the scoping was the need to build systems for surveillance on antimicrobial use, and the importance of using tools or developing tools that would support antimicrobial stewardship, including clinical decision-making for appropriate use and training. infection prevention and control initiatives were already in place through various partnerships that had gone on in the past, for example, through USAID, UNICEF, but also WASH and also WHO. So we were building on those rather than reinventing the wheel. Also looking at the WHO documents that had been published at that stage, particularly around the competency framework. And at the time when we were developing this, the WHO's global PPS had not been published, or its antimicrobial stewardship toolkit had not been published at the time when we were launching CwPAMS. And so at that stage, we used the global PPS program, and the global PPS program has been particularly useful for direct immediate feedback to institutions, and colleagues from the UK are very much used to running PPS within their organizations. So we had an overall aim around leveraging support from UK institutions, the stewardship expertise we have, and volunteers to strengthen the capacity of national health workforce and institutions in 4 Commonwealth countries to address AMR challenges, and also funding to cover travel and delivery of those interventions, with UK healthcare and academic teams volunteering, particularly ensuring that every partnership included pharmacists. And it was also important that those partnership models were likely to ensure sustainability, but also to be seen as pilots within the countries as what could be potentially scaled up. 12 partnerships were funded across Ghana, across the 4 countries. 5 of the partnerships were in Ghana, 5 in Uganda, and 1 in Tanzania, and 1 in Zambia. And within all the partnerships, there was specific training as well, and a key importance placed on the importance of ensuring that the principles of partnerships were followed throughout. So that's around effective and sustainable, being strategic, ensuring that it aligns and harmonizes with the country and with the institution that the colleagues were working with. We had Inception Workshops, which included global PPS training in UK, Uganda, and Ghana. And what happened with Zambia and Tanzania was that they joined in one of the other countries as well. And as you can see there, those are the Inception Workshops across UK and Uganda and Ghana. We developed several tools, particularly antimicrobial stewardship and behavior tools, which were then used as baseline assessment for the institutions that colleagues were supporting or working in. And then there was healthcare workers survey as well that partnerships could choose to use. The stewardship checklist tool was mandatory and was developed based on an international consensus published review. As I said, at that stage, the WHO antimicrobial stewardship checklist was not in place. We also developed an app using the microguide app, so learning from experience in the UK, but developing an app for CwPAMS, which included all the 4 countries' national antimicrobial guidelines. We had shared learning was very critical throughout the process, and we had a shared learning platform, and also included webinars and podcasts through times, and also in-person shared learning events. This was, as you would have imagined, was meant to be a face-to-face event, but because of COVID, we are where we are today. In terms of evaluating the program, so we have very much started that, and the next few slides will just share some of the key data that we have. TEF, who are the program managers, they commissioned Ingentium to carry out what we would classify as a semi-independent review, and I say semi-independent because they were obviously talking to us and talking to partnerships to get the information that they needed, but they wrote the report and analyzed the data. We had a theory of change that we worked through, and our core impact was around improved and maintained capacity to prevent morbidity and mortality associated with antimicrobial resistance. And obviously working backwards, we've got outcomes, outputs, and the inputs that we set out at the beginning, and I will share some of those results in my next couple of slides. So some of our key headlines of results is that throughout the 12 partnerships. So there were 12 partnerships and 14 institutions, 670 colleagues in Ghana, Uganda, Tanzania, and Zambia were trained in antimicrobial stewardship, antimicrobial prescribing practice, and consumption based around the WHO competency framework. And 379 of them demonstrated improved knowledge and after training. And so not every partnership did a before and after assessment, but of those that did, 379 have done those. And at the time we were developing this, 10 of the 10 institutions had collected and fed back their antimicrobial consumption data through global PPS. What's really key here is, so this is obviously including and fed back. All institutions had carried out global PPS, but because of challenges, some of it linked to COVID, at that stage when we were analysing the data, some had not fed back the results of the data. We didn't have access to the information to be able to have that. But what's really key here is that at the time when we were going into the 4 countries, only 1 institution in any of those countries had ever carried out PPS. And so as a result of CwPAMS, we now have increased capacity around PPS, and what's really good is that even with the WHO PPS protocol, we have colleagues ready who are able to carry out the survey should it be needed. And thank you again, as Keith Rich said earlier, in terms of the NHS contribution, 815 volunteering days have been contributed to these countries, and it's just phenomenal. And you can see on the image on the right, in terms of nurses, were majority of the cadre of healthcare colleagues that were trained, and pharmacists as well there, and others are other colleagues within the healthcare. So community workers, particularly in one of the partnerships were a key focus. And so really good to see that we moved outside of the healthcare settings into community health workers who have a key role in supporting health of their communities. And 9 UK institutions have been actively including their volunteer skills and experiences within their workplace, and it's really great to see, and you'll hear some of that as the fellows start to share. In the interview data, you can see that some of the factors that contributed to the positive changes within the health partnerships were around communication, hospital, flexibility, engagement, agile working, and training. So these are just some of a word cloud that was created by by Ingentium. This particular quote is by one of the fellows, and says, "I learned a lot about fellowship in low resource setting. When COVID happened, I found out that I could apply what I had learned here as the pandemic turned the UK into a similar low resource setting. The skills I had learned in stress management and operating in high pressure environments were extremely helpful." And you'll find out as we share later on some of the fellowship projects and evaluation that this theme around those colleagues who have participated in global health and their resilience around COVID has been quite really helpful to see. And so another analysis was analysing or rating the CwPAMS program used against the OECD criteria in terms of how relevant it was to the countries, how much impact, the sustainability, the efficiency, and the effectiveness. And as you can see there, that we have done, the program was assessed as achieving more than 70% across effectiveness, impact, relevance, and sustainability, and 63% for efficiency. And we're working through those learnings at this stage. There's been wider impact as well. So although, those were built in smaller 4 or 5 institutions in Uganda and Ghana, for example, some of there's been some work to build that work into national programs. And for example, in Uganda, the IDI team who are leading on the Fleming Fund national activities for antimicrobial resistance and have a role nationally, have used the CwPAMS AMS checklist across more hospitals within Uganda. And we've been, you will hear through the panel how CwPAMS has built a case for clinical pharmacy as well. I'm just going to go straight on now to the fellowship, and I'm going to skip through some slides just so that we make sure we don't go too far into time. And what the fellowship, so as I mentioned earlier at the beginning, for those who were there, the Chief Pharmaceutical Officer for England, Keith Ridge, proposed that there should be a fellowship linked in with CwPAMS, and through that, we were very grateful for support from HEE colleagues, particularly Chris Cotts, Peter Morgan and Fleur, in developing the what has become the CPhO Global Health Fellowship, with sponsorship from Health Education England. And we built on the success of HEE's IGH Leadership Development Programme, and that's very much similar to what these fellows have had to go through, but obviously more tailored for pharmacy. And Peter was one of the CPhO National Clinical Fellows, and he was a great support for this. And the aims for the fellowship was around supporting sustainable improvement in healthcare, but providing that unparalleled personal and leadership development experience, and helping to develop a cadre of skilled health leaders with quality improvement skills, but also global health and global pharmacy skills. It was a partnership between HE and Health and CPA, with HE overseeing the funding and the commissioning of partners, and CPA then running the fellowship in terms of the management, facilitating global pharmacy training and of the evaluation, and this final event that we're organising today. I'm going to skip through these slides, but it just shows the amount of work that the fellows needed to do in terms of making sure that they had to have ownership or leadership for one or two deliverables within the overall partnership log frame that they had direct responsibility for, and that's what they will present on today. And they also went through a leadership program, which is linked to the NHS Leadership Academy. And they had support from a mentor and had monthly meetings, which we believe happened except for during COVID. And so they've had a mentor to mentor them through global health, but also through leadership, and through their career progression as well, which is they have found really valuable. And then they had a global pharmacy webinar and action learning set each month, which is where we got on to every month they had a webinar, and they actually had to do, they had to go through a learning program similar to what master's students for global pharmacy will go through, and also show that they embedded their learning. So they had to create, actually we'll explain some more on that later, but the action learning set was very much around them peer support for each other. So at the induction day, you can see Emma Foreman there, who I'm co-hosting with. She's been our fellowship advisor throughout, and very much the lead for the global pharmacy aspect of this program, of the fellowship program. So there was a 3-day induction at the beginning, and that's where they started to have training on leadership behavior and development, how to project planning and evaluation, and how they were going to work with their mentor throughout. And you can see some tweets there from the fellows on the day. One, I'm just going to highlight this one because Pharmacists and role play is a well known fact that we joke about. Who knew role play could be so good? Thank you to Proactive Tweets. So Proactive is an organization who uses actors and help you to actually go through a range of scenarios in real life and practice them. And a couple of the fellows have highlighted how very difficult situations that they went into before they went to the induction has been resolved because they had an opportunity to practice it on the day, and they've been using those skills since then. And again, that's Fleur who led on the induction, and she's the director for the International Global Health Fellowship at HEE. And then at the end of the fellowship, which is what they're presenting today, they're going through a process of, they've had to write an abstract and manuscript and posters. The abstracts and the posters are on the Google Drive folder we shared with you, and also a significant amount of work linked to the global pharmacy period of time. Emma, did you want to say anything else with the global pharmacy section before I move?
I think really just to say that it was important for the fellows to learn some of the sort of theory and more academic background to global health and pharmacy's role in global health. We were lucky enough to get Sarah Marshall as a speaker, who is the course leader for the Global Pharmacy MSc at Brighton and Sussex Medical School. We ran a programme going through the theories of global burden of disease, health indicators, social determinants of health. And for each subject that we covered, the coursework encouraged the fellows to relate what they just learned to the country that they were partnering with. So it was really important for them to learn the practical application of what they were learning, and it helped them to perhaps understand their partners in their partner country a little better.
Thank you, Emma. So in terms of evaluating the fellowship, you'll hear about that later, because that's part of what some of the fellows will be presenting on.